we all come to this work as therapists, or if we're working with these medicines, as unique individuals. And I'm going to just say a little bit to give you a sense of where I'm coming from. So a little bit of my personal history. I'm obviously a white male. I'm straight. I got the doctor degree. I have affiliation with Harvard. So I have kind of all these privileges going for me that leads me to be more likely to be in front of you in this way. So that's definitely, part of where I'm coming from. I was someone who, as a teenager, started using cannabis pretty early and experimenting with some of these drugs in my teenage years. By the time I ended college, I had maybe had 10 experiences with MDMA and a few different psychedelics. And in those experiences, I had, what we would call mystical experiences, what to me felt like revelations about the nature of things and who I am and what life is about and that kind of stuff. I had, with MDMA in particular, I had 2 experiences with that in college, and these were very powerful, life-changing experiences for me, very heart-opening experiences. I had no idea there was so much love within me and in the world until I had that medicine. These medicines also introduced me to my lifelong Buddhist meditation practice that Chris mentioned at the beginning. And one of the most important things that I want to highlight out of this was, so here I am, 18 to 22, experimenting with these drugs, having no idea what I'm getting into, having some big experiences, but having some difficult experiences too. And even the best experiences I had, for me, I realized at that young age that it was going to be years and decades of hard work on my part in therapy, in relationships, and spiritual practice to even integrate a portion of what I had gained access to briefly in those altered states of consciousness. So, integration is so important. And that was something I realized as a young person, like, wow, I've got a lot of work to do. It's not like I'm just going to have some big revelation and now I'm the new Jim and everything's going to be great. So that was a real recognition for me. And then I did not do anything with these medicines for almost 30 years while I got to the work of living and growing in relationships and doing things. And, I guess I could have potentially made use of these medicines in the meantime, but that wasn't my path. But I always hoped that there would come a time in the culture when these medicines could be used and that I could be a part of that. And I'm very grateful and fortunate to have been able to be included in the MAP study and then be involved in this work. In terms of my professional history, yes, I'm a psychologist, but I also love to study history and politics and philosophy and religion and try to contextualize the things we do in those larger contexts. Clinical psychologist by training. I've really focused on trauma, as Chris said in my little bio there, since the early 90s. My many, 3 decades here in Boston, a lot of focus on trauma. And when I'm talking about trauma, I'm talking about psychological trauma and thinking about how these are interpersonal traumas for many of our clients. And they're embedded in relationships of abusive power and exploitation, not just within families, but in politics and capitalism and other things. I'm very interested in the brain. So I've really studied a lot about neurobiology of trauma, neurobiology of addiction, neurobiology of spiritual practices and psychedelics. So that's an important part of who I am, what I do professionally, and what I try to share with people. I also try to help transform institutions and cultures through my trainings of police and prosecutors and judges and the military and people like that. I'm not naive about how much impact I can have, but I'm trying with others to help out and bring about some transformations, especially around how people deal with sexual assault trauma. And I'm also very interested in the spiritual and moral aspects of human suffering and healing and happiness. And so those are big focuses for me. And I've written a bit about that, as you can see on my website and editorial I wrote a year ago. And then, in the last 5 years, I've been involved in the MAP study. And so that's a big part of my professional identity. And while I've been working in trauma for so many years, I do see the psychedelic work as complementing that, but also a new sort of strand of what I'm trying to do in the world and be helpful with. So that's part of where I'm coming from. I want to acknowledge, though, I have, significant limits to my experience. So I have not worked therapeutically with psilocybin, for example. I've only worked with 4 participants in the MDMA study in 12 of these, 8-hour sessions. I've had 4 ketamine-assisted therapy clients and done about 25 sessions. I did get the MAPS training, which is quite wonderful and in depth of good 5 days straight of just watching videos and discussing what's going on in these sessions and in the integration sessions. And that's a really important learning process. And then finally, with my colleagues here in the Boston area, who are also part of the MAPS study and are doing the ketamine-assisted psychotherapy, we have peer supervision. We hear from each other. And some of my colleagues have been doing more CAP than I have, for sure. And I learn a lot from them. So I have some experience, but I'm not that far beyond any of you who are just starting out, honestly. But I do feel like I've learned some things, and Chris and Ron and Laura, feel like I have some things to share. So hopefully you will feel that way too. Also, part of who I am is I definitely have critical perspectives about things. So I'm definitely against the medical model, which I see as re-traumatizing and often thwarting healing and justice. This idea that patients are supposed to comply with us as the experts telling them what our manualized or other treatment is, or medications and things like that. I find that to be a very harmful model. I'm very wary of spiritual materialism and a lot of new age stuff, gurus of any kind, and frankly, most influential and famous people. And I'm very committed to equity and inclusion. I see people for free. I see people who are non-white. I'm really concerned with that. I'm not doing as much as I could on that, for sure. But it's an area where I feel deeply committed. And I've long studied racism in this country and very concerned about that. And I'm frankly worried about what's happening with this psychedelic renaissance, with all the business people getting involved and the greed that is really coming in a big way. And also, I'm concerned about therapists who are not competent and who may be narcissistic in ways that they end up exploiting and using and hurting their clients, not just sexually, but in other ways too. So these are all things that are critical perspectives that I bring to this, and I'm very concerned about. And I'm happy to talk about those in the question period. A few notices and cautions before I dig into the clinical aspects. One, I am not suggesting or recommending or condoning any illegal activity. I do not refer anybody to underground therapists. I'm not doing anything that is illegal in any way. I'm doing this all above ground, above board, consistent with laws and ethical practice in my discipline of clinical psychology. And I want to acknowledge, right up front here, some of the risks of MDMA, especially people using it outside of safe and legal treatment contexts. If you're buying it on the street, you don't know what might be in there. There might be fentanyl or methamphetamine in these medicines. The doses can be much higher than you might expect. If you're not sufficiently or competently prepared for these kinds of experiences or supported afterwards and during, there can be very negative outcomes. And I know this came up last week, and Dr. Grove gave some examples of that. And so there's real potential for psychological, social, and even physical injury with these medicines if they're not used very carefully and thoughtfully with people who know what they're doing. Other risks, as I mentioned before, clients are very vulnerable in these states of consciousness to narcissistic and exploitive therapists. In an altered state, the client may experience intense emotions and needs. They may experience sexual arousal or attraction to the therapist. They can literally lose their ego boundaries. They can have impaired judgment, and they can even have loss of awareness entirely of their body or even their identity, for example, in a high dose ketamine session. So this is an incredibly vulnerable state, or these are potentially incredibly vulnerable states that people can be in. These long sessions can really increase intimacy and the intensity of the experience of the relationship, which has its own psychedelic aspects to it. Psychedelic means mind manifesting, or psyche or soul manifesting. And it's a more intensive form of therapy, even if the medicine wasn't involved. And in the placebo cases, it's still a very potent modality of spending 3 or 8 hours with a client who is lying down and going inside and accessing some really deep and painful things. So just that frame of the long sessions and the intensity and the intimacy of that leaves people very vulnerable to being exploited. The agreement to supportive touch, that can be exploited. And if anything is illegal is involved, so if people are doing underground or a mix of underground and above ground work, this can create secrecy, which can replicate people's families of origin and secrets in their family, and just generally be very bad for the therapy relationship if people are doing things that they have to keep secret from others. So these are all potential dangers if they're working with therapists who are exploitive or narcissistic. And we all have our narcissism of different kinds that can get triggered in different situations. So this is also just about being competent and knowing your own vulnerabilities and limits and getting good supervision. But there's real risks in this work in those aspects, and I want to acknowledge that. And finally, even if the treatment is very well done with a competent, well-trained therapist who does a great job in preparing people and supporting them afterwards with integration, people can still recover memories that they didn't even know were there, which can be very destabilizing. As in any trauma treatment, sometimes people get worse before they get better. Now, obviously, you don't want to be opening up all kinds of memories and doing more and more of that, but sometimes it happens whether you want to or not, you're not expecting it, and it can be very destabilizing for people. People can get very attached to the positive experiences and grasp and cling to the parts of the experience that they really liked, have ego inflation, as Jung said, around these things, and that can actually get in the way of their healing. There can be grandiosity and other things going on, and that's a risk of this work, even when it's done really well. People can go to those places where they get really attached to the positive in ways that actually prevent them from integrating it. And then finally, there's a risk, I think, especially, as this becomes so trendy and everybody's all excited about it. I'm very excited about it, but we don't want to devalue all the other good therapeutic modalities that are already out there and what people can benefit from without necessarily using these medicines or doing this intensive kind of work. And sometimes people get a taste of this work and then they think, well, all that other therapy, that's just, pale comparison to this is the real stuff. And, that's a danger, and that's something we really want to protect against too. Okay, so I want to talk about some of the clinical aspects of this. And some of this I'm borrowing from a mentor of mine in the MAP study, Michael Mithofer, a lead PI in the phase 2 studies, medical director of the phase 3 PTSD studies. And so, we're all learning from our elders, and Michael is a longtime student of Stan Grof, who did LSD psychotherapy in the 50s and is still working in his 90s, facilitating holotropic breath work and things. So there's a real tradition of psychedelic psychotherapy in this country and in Europe that I'm drawing on here. And so in terms of the therapeutic approach, some of the key things about this approach is it's a non-directive approach. And the idea is that we are supporting the emerging experience of the client. So there's a real deep faith that people have within them. This inner healing intelligence is one phrase that's been used for this, is the therapists genuinely have and convey to the client a deep faith in their ability to heal themselves with the right support, with the right conditions. And that links up, as I was just saying, with the non-directive aspect. You don't need me to do things to you to get better. My role is to create conditions where you can access your healing potential within yourself. And so a big part of this therapy is literally going inside, reclining, as this woman is here in the picture on the left, putting on eye shades, wearing headphones and listening to music that can usher you and guide you through or support you through the experience. And that's a really, really important part of this. People can be inside, not talking to you, not even taking off the eye shades, 30 minutes, 45 minutes, an hour, and doing incredible work. Now, obviously, as a therapist, you have to learn how to be sensitive to when they might be stuck in there and those sorts of things. But it's a big part of this work is people being inside and having all kinds of things happening that we can't see, and they can tell us, at least to some extent, about later. And so there's this alternating focus of people being inside with that inner focus, going with what is emerging, coming from their own inner healing intelligence, and then coming out and speaking with us as therapists about it. And, sometimes they might come out and talk, and they might want to talk a lot and have some question, and we might say, that sounds like a really good question to take back inside. Do you feel comfortable doing that now? And they'd be like, oh yeah. And they'll go inside with that question instead of having to use their analytic, verbal, conceptual mind to try and sort it out with us. They go inside and they get often a way better answer in imagery and embodied experience and whatever than we could have ever given them in a conversation. And one thing that's super important about this work is it really allows for the individual skills and styles of therapists. Again, we're all unique people coming with our different backgrounds, personal and professional, what therapeutic modalities we're trained in, which ones we feel most comfortable in. And the beauty of this work is it really allows you within this larger frame of doing non-directive, psychedelic assisted psychotherapy to draw on your own skills and talents. And I'll be talking more about that. And finally, I've mentioned this before a couple times. The model always is there's a preparation phase before anybody takes the medicine. And then there's integration afterwards to help people integrate what they were able to access in that expanded state of consciousness. And that's so important. There's so much focus on what happens on the medicine. When people talk about, well, how does it work? They immediately go to these reductionistic neurobiological explanations of how the medicine is affecting them for those couple hours. And I think, that's really interesting and important stuff, but you're really missing a lot if you're not also focusing on integration, including the biology of integration. And we can maybe talk about that in the question period. And then finally, a really key thing about this, and especially as a trauma therapist who thinks about what's good trauma-informed care, is that this model is very much about empowering the client. And drawing in self-determination theory, I would say two key ingredients of empowerment are supporting the autonomy of the client and their competence. And this is just absolutely central to this way of helping people to heal, is we are empowering them. And that's why we have to be very careful about therapists or parts of ourselves that may think like, oh, I'm going to do this to them, or I'm going to blow their mind, or they need to experience this, they need to experience that. Whenever you find yourself thinking that way or hear someone thinking that way, that should be a big flag when you think about what they need and what you need to make them do and things like that. And this model is very much not doing that. It's creating conditions to empower them, access their own autonomy and competence and healing intelligence. So those are some of the key ingredients, and some of these we're going to return to and weave them in different ways as we go forward. So we can talk about psychedelic psychotherapy, which is the title of this course we're taking here, this conference we're calling it. But that can also be broken down into psycholytic versus psychedelic, and these are terms that come out of the tradition going back to the 50s and 60s, Stan Grof and others' work. So psycholytic, this is a model where people are doing low doses of a medicine. It could be, LSD, it was traditionally, it could be ketamine, every week or two. So really weaving it into the therapy on an ongoing basis. And the idea is that low doses of these medicines, you can loosen defenses, you can expand consciousness to some extent while people are still very much in the room, in their body, and in connection and relationship with the therapist, as would normally be the case in a talking therapy modality. So that's the psycholytic model. And Stan Grof has written a lot about how things can unfold over time when a medicine like psilocybin or LSD is woven into the therapy in this low dose way over weeks and months. And then there's psychedelic, which is about, and this is the model that's more, the Hopkins group and is more popular with the psilocybin research and even the MDMA research in a way, because you can't really do low dose MDMA that well, as we'll talk about. But psychedelic is different. It's going for higher doses, usually weeks or months apart, several weeks, to allow people time to integrate the big things that they can tap into. And it's not just loosening defenses, but at these higher levels, it literally can dissolve defenses, can dissolve the regular schemas that people have to organize their experience. It can dissolve the sense of being a separate self altogether, as people talk about ego death. And in this work, people tend to be aiming for big experiences, big mystical breakthrough, transpersonal kind of experiences. And so this is an important distinction to make when we're thinking about psychedelic psychotherapy, that you can work with lower doses and you can work with higher doses. And of course, it can be a continuum, for example, with a medicine like ketamine. So let's talk about that, MDMA versus ketamine. Now, these are the medicines I've been working with. I have not been working with psilocybin. So these are the ones I can speak to as, what it's like to practice this kind of therapy. So MDMA, some of you may have heard, these are 8-hour sessions. MDMA is reliably, more reliably than ketamine at dramatically reducing fear and bringing about a heart-opening experience, a connection experience of warmth and kindness and compassion toward oneself and feeling of connection to the therapist. MDMA is much more likely to bring these things out in a big way. But with MDMA, you're kind of working with a narrower range. So like in the MAP study, it ranges from like 75 milligrams up to like 120. And below 75, it is related to methamphetamine. So people tend to feel anxious, but not get the fear relief and the open-heartedness. And it can be like a nocebo effect. It can be an adverse effect. And then at the moderate, at like around 75 to 80, people can really have the heart opening and a sense of safety, but they can still have a lot of their cognitive functions, and they can, hold those loosely or just kind of put those aside. But they can, if they want to, they can think through things. They've got some pretty good prefrontal cortex and analytic reasoning capacities that they can draw on at different times in the session. But when you start going up to like 120 or higher, it's much harder for people to hold things in mind, and they can just kind of get swept away by the river of their experience. But that's still a relatively narrow range compared to, say, ketamine. Now, ketamine, the sessions tend to be 2 to 4 hours because when you take the medicine, you're on a plateau effect on the medicine for about 30 to 45 minutes. Kind of you can go up and then hang out there for a while and then it starts to come down again. Whereas MDMA, you're on that plateau for a few hours, especially if you take what we call booster dose 90 minutes in, which is offered to people. But ketamine is shorter. Ketamine is also less reliable and powerful in terms of reducing fear and heart opening. Now, ketamine can look very MDMA-like, and it does, and I've seen that and found that in my clients, but it's not MDMA. So it's not as reliably fear-reducing and heart-opening as MDMA tends to be, but it can be. And with ketamine, you can use a wider range of doses. So you can start with a very low dose. I have a client now who has a connective tissue disease who is able to take like 37.5 milligrams via mouth and then do a massage appointment, and is making progress with massage that she hasn't made in 10 years, working with an amazing massage person who's made a lot of progress with her. But something about the ketamine being in that state is allowing her to loosen and let go even more and get some of those physiological benefits. In sessions with me, she's used 50, 75, 100 milligrams of, again, taking it by mouth, and it's absorbed through the mucosal membrane. And this is a place where people can feel at peace. Their mind can kind of quiet down a bit. They can actually feel safe in their body. And we'll talk about those experiences later. And then you can go up to higher doses where you can give someone an intramuscular injection, and someone can have a complete ego dissolution experience where they have no awareness of their body, of their mind, of their identity, of any of their memories or anything. They may experience unity with the Godhead, whatever language they're going to put on it. So ketamine has an amazing range of doses and experiences that people can have along a continuum. And that's one of the things I love about ketamine is it's short acting, and you can work with it in so many different ways tailored to that individual and what their needs are and where they are in the unfolding of the therapy and their process. So again, coming back to this basic framing of this work, it's not just about what happens on the medicine or in those 8-hour or 3 or 4 hour sessions. It's about preparation that goes into it in advance. And so in the MAP study, we meet with people 3 times before they take the medicine for these preparation sessions. And in those sessions, we're doing things that I'm going to show you in a minute from actually the adherence guidelines from the MAP study, where people are watching our videos and saying, hey, did you do this? Did you do this? So the preparation is really, really important. You don't want to take someone into these expanded states of consciousness until the preparation has been done, that they're going to feel safe and connected with you and have a strong intention about how to make use of that, but also a real openness to whatever might arise. And then after those medicine sessions is the integration work that we'll be talking about later. That's fundamental. So this is, from the MAP study. These are the adherence and competence criteria that are applied by raters to the sessions that my colleagues and I do. And so, these boxes are just going to pop up to highlight some things. I don't want to try and read every one of these sentences, right? So there's these general things that we're doing. We're creating a setting of safety and support. We are using this language and this frame with the clients about inner healing intelligence and this faith we have in them, that with our support, they can access this inner healing intelligence. And it's our job to support them in doing that and unfolding that. And we also, of course, are addressing their expectations, their hopes, their fears, concerns they might have. We don't want people going into an MDMA session or a ketamine session with unanswered questions or concerns. And so it's so important to just have those conversations about whatever they might be hoping, fearing, wanting out of the experience. We talk about positive, affirming experiences they might have. We also acknowledge that they might have negative or difficult experiences. And we elicit significant historical information. Obviously, in the MAP study for PTSD, we're getting information about their trauma and what their intention is for if they have multiple traumas, which one they think they want to start with, and that sort of thing. So these are all part of the preparation process. We are educating the client that this is a largely non-directive approach. And we talk to them about the kind of interventions we will be doing, and they have a good sense of what we're not going to be doing too, and how it's going to be maybe different than what the therapy they're used to. We talk to them and really help them get to a place where they feel like they can be open to whatever's going to emerge when they're on the medicine. And we talk to them about how it works with these alternating periods of going inside and then coming out and talking with us, and how we will respect, the balance that works for them. Sometimes we may encourage them to go back inside, but ultimately it's up to them. They don't have to wear the eye shades and go inside. And sometimes people spend a couple hours talking, and that can be okay too. We talk to them about how we're going to inquire about their body sensations and how these are important aspects for many people. We talk about how physical touch is optional, and we make it very clear that we're going to respect their boundaries. We talk in advance about what kind of touch they think is going to feel comfortable to them. They have a stop signal that they can give us at any time if they want touch to be terminated. So there's a lot of careful, thoughtful conversation around that to make sure that people are having informed consent about that we know what's going to feel safe to them, and that in the sessions, we are also very sensitive if they feel like they want more touch or something like that, to be very careful about erring on the side of being cautious and not touching too much or something like that. And we talk to them about the music and how we'll have a playlist that we can adjust along the way to support what we see emerging in their experience. And we talk to them about the eye shades and the headphones to really facilitate that going inside. So these are all things as part of the preparation over 3 weeks that we're talking to people about, as well as just attending to the Therapeutic Alliance and questions they have for us and things they need to know about how we work and our experience. All those things are attended to in the preparation phase. And so this is a really important concept of set and setting. Timothy Leary coined this concept in the 60s. Set refers to like the mindset of the therapy patient or the client or the participant in the MAP studies. So what hopes, what expectations, what history are they bringing to it? And what is their intention for that session that they're about to enter into? And then the setting is, as we're seeing here, it's the room that they're in. It's sitting with 2 therapists, being able to lie down and recline, having the music, fresh flowers in the room, these kinds of things. So all that goes into creating literally a physical and relational setting that will be supportive of the work. And the idea is that if we really do the preparation right, and if we create the right set and setting, that this is what enables people, I would say, to let go and receive what they can access in that altered or expanded state of consciousness that the medicine with that set and setting and our support can help them get access to. And so again, that brings us back to this idea of the inner healing intelligence, the preparation, the set and the setting. It's all about creating the conditions where they can access their own inner healing intelligence, the wisdom of their own soul or psyche, however you want to understand that. Absolutely central to this work. And Michael Mithoefer was an ER doc before he became a psychotherapist, and he, put a lot of casts on and helped a lot of people with broken limbs. And it's a really apt analogy that he talks about is, if when someone breaks their arm, this little girl breaks her arm, we don't have to tell her arm how to heal, right? You set the bone and you put the cast on, and basically you're creating conditions and supporting an innate healing process of the body to bring the parts of the bone back together and heal. And the same thing is true of the psyche. If we create the right conditions, the psyche knows how to heal. There's innate healing wisdom that can unfold. And a lot of the time, our job is to get out of the way. And so, that's so important that this, again, I keep coming back to that theme. We are supporting the inner healing intelligence of that unique human being. Now, this is a nice brief paper that you can get online. It might be in part of the handouts directly through this. Is by Michael Mithoefer, again, lead PI, phase 2 study maps, overseeing phase 3's medical director. And in it, he talks about how MDMA-assisted therapy and other psychedelic therapies too, they're really drawing on a lot of things you already know and are already using. So we can think of it in terms of elements of other therapies that arise spontaneously in MDMA and ketamine-assisted sessions, which is where I have more experience and I'm talking about, right? So in any good therapy, right, you're going to want a safe, supportive setting that you create for the client. One of the things that happens a lot in these MDMA and ketamine-assisted sessions is people spontaneously do imaginal exposure. They revisit old traumas in very vivid and intense ways, and they may remember parts of those things that they haven't remembered in decades. And that can be a very important part of the healing, of course. People are engaging in cognitive restructuring. They are having insights. They are having revelations. They are having new ways of understanding themselves and others and their relationships and their memories. And that's a very big part of this. Psychodynamic processes can be going on. There can be really intense transference. And in our role, there can be powerful countertransference responses we can have. And this can be an important part of these sessions, as well as, of course, the integration process. It can be a very important corrective attachment, to be on MDMA and feel that safe and that much love for several hours with a male and female therapist or 2 female therapists, however it is. It's usually male and female. That can be a very, very beautiful, powerful attachment experience that gives people a deep sense in their body of what it can be like to feel that safe connection to people in a way they maybe never have before. They've been wanting to get there with their current therapist. Without the medicine, they just haven't been able to get to that depth of connection yet. And so the MDMA can facilitate that, and ketamine can too. Active imagination. It's a Jungian concept, but it's the idea that, in these expanded states of consciousness, people's imaginations can bring them incredible images and metaphors and visions of their future that can be a really important part of the healing process. And we see this in regular therapy, right? People can have these new images and metaphors and visions and things. And in these expanded states of consciousness, they can happen very easily and very powerfully. Another important part of it is the multiplicity of the psyche. Some of you are trained in IFS, very, popular mode of working with that I use in my work. We see people spontaneously in these sessions have internal dialogues with different parts of themselves. In like 80% of the cases, Michael Mithoefer estimated over about 20 years in the phase 2, well, about maybe 15 years in the phase 2 studies, of people just spontaneously doing IFS work, like doing the most beautiful IFS work you've ever seen without the therapist even saying anything about IFS to them. And so this is something that happens in these sessions sometimes. And if you know IFS or other modalities for working with parts, you can, facilitate that and support that even better. Very powerful somatic processes can arise in these experiences, and then spiritual and transpersonal experiences. And one way I think about this is, again, we're not doing things to the client. We have these models and these interventions and these tools in our toolkit as therapists, as unique therapists. But when we're doing this work, we really bring those with a very light touch. And one of my colleagues in the MDMA study felt like she really had to learn to she's a more experienced therapist than me, kind of day in, day out. I do all kinds of other stuff. And she really had to unlearn some of her habits and kind of inhibit her impulses to do and say certain things, not throw all her tools out the window, but just be less apt to jump to them and use them. And she found, that was a really important part of, again, allowing the client to find their own way through it. And so this is a quote from Irv Yalom, the therapist must strive to create a new therapy for each patient. But another way to think of this is, or maybe the therapist can encourage and support each person to create a new therapy for themselves. And that's really how we think about the MDMA work and the ketamine and psilocybin work. A lot of us is that our job is to create the conditions where the patient creates their own therapy. And so here's just some quotes from people from the MDMA study and some of the ketamine work. In terms of imaginal exposure, one of the people said, look, I don't know why they call this ecstasy, right? It can be very, very difficult and painful to remember that car that blew up in front of you in Iraq with children in it, for example, right? These are very horrible experiences that people are bringing to this work. And sometimes the exposure work is quite excruciating. It can be healing, but it can be very, very difficult. The transference issues can be very powerful. People, this was a person who said, will you brush my hair? And the therapist did not make some psychoanalytic interpretation of that. They were able to engage in that behavior in a safe way with the person, and it was a really important part of their healing. But also the therapist is, responsible for their own countertransference, for boundaries, for handling these things constructively. But the transference can be very, very powerful and a powerful part of the healing. The corrective attachment relationship, just to have two people giving you their loving attention for 8 hours straight, or for 3 or 4 hours straight from one therapist in a ketamine session, can be a very powerful attachment experience. In terms of multiplicity of the psyche, if you want to, if you haven't dipped into IFS yet, I recommend this as a great intro book. But this is a quote from an MDMA participant I worked with in the last year. And he was inside for about a half hour, took the medicine very quickly, kind of went in after it came on after about 20 minutes, went inside for about a half hour, came out and said, all the different parts of me were sitting together in a circle. One by one, I took each by the hand and we had a conversation. I reassured the parts that hold the fear, the shame. And he talked about all these different parts of him that he just spontaneously did this beautiful piece of IFS work with, in the first 40 minutes of his first MDMA session. And he knew almost nothing about IFS before he did that. In terms of somatic and bottom-up processing, we encourage people to bring awareness to their body in these experiences if they're not already doing that sometimes, if we're observing things in the body, and that can be a really important part of the process. We encourage them to move if it seems like they might be stuck or there's some movement happening in their foot or something. We encourage them to explore that, and that can really unfold in powerful ways. As I talked about before, there's optional, no one is required to receive touch from a therapist, of course. We talk about that in the preparation phase, but this optional mindful use of touch with permission and careful agreements in advance can be a really powerful part of the healing. And by now I've spent many hours holding people's hands while they're having these experiences. And nurturing touch, a gentle hand on a shoulder, a gentle hand on the foot sometimes. It's all people need. It's gentle, but there's a little nurturing in there. And that can just be so helpful for people moving through certain things. Other times you don't touch and you have to monitor your own countertransference. And is it me who's trying to soothe myself by touching them? So there's a lot to be worked with and understood mindfully about the somatic work. And there's good training out there for this stuff, of course, but it can be a really, really important part of the work. And then sometimes people have these sort of blocks or that they're experiencing in their body, and they can do focused release work. You know, again, this is something you should have training in before you try it. But it's long been a part of psychedelic psychotherapy and MDMA-assisted therapy, and can be a really important part of what's going on in these sessions. And so here's a process I observed in an MDMA participant in terms of bodily phenomena unfolding over one session. So in the beginning of the session, like his head was going back and forth, and like you could see that he was inside and he was like seeing unpleasant and remembering bad things from his childhood. And you could see the aversion and the fear and the sorrow kind of coming over his face as he's shaking his head. But then, you know, maybe 30 minutes after that, his hands, which are usually clenched before the therapy anyway, they unclenched, they opened up. Then his arms and hands were out to the side, and just you could just see it. He was just receiving this awe and gratitude. And he told us, you know, later that it was what he was experiencing. And then his hands came up to his heart and just stayed there for a while in his heart. And he was having this incredible heart-opening experience of love and kindness and compassion for himself and his mother. And then finally, his hands spontaneously came up into a pose of prayer. And this was a guy who hadn't gone to church in many years, didn't consider himself religious, but spontaneously his body assumed this pose. And it was a very powerful part of the session for him. And so this is just, you know, one sequence that evolved over the course of one session. A couple other things I want to say about this, especially with regard to ketamine, is, you know, Dr. Grobe and others tend to refer to ketamine as a dissociative anesthetic. But I think that's a problematic term, because at lower doses, you know, my colleagues and I are finding, and our clients are finding in their own bodies, right, that it can actually modulate interoceptive input, right? So the dissociative aspect, yes, it can decrease interoceptive signals coming out from the body, but that can help people feel safer. It can give them more access to feelings, and it can give them a greater capacity to process sensations and emotions. And here are some things that some of my clients have said in ketamine sessions. I feel so relaxed. I like this. I've never felt this peaceful and good in my body. For the first time, I can feel the sadness of not being held by my mother. That broken little girl, I can feel her pain. So this is not someone who is dissociated from their emotions due to ketamine. This is someone who has gotten a little buffer that they felt safer to going into their emotions and their embodied experience, and then experience them more powerfully than they had before, and in very healing ways. Now, obviously, you know, I'm skimming the surface here in some ways, and there's a lot of complexity that you don't have time to address, and maybe we'll get into some of the questions. But people, you know, in IFS language or psychoanalytic language, we can talk about defenses and protector parts. You know, I have a client I work with who, on his first ketamine session of 100 milligrams taken by mouth, you know, this held in the saliva, absorbed through the mucosal membranes, he had this incredible experience of release and relaxation. This was someone with treatment-resistant depression who felt like this sense of like, wow, it's the first time in years I've just felt peaceful. And then, you know, a couple months later, we tried a higher dose of 300 milligrams because he was interested in seeing if a mystical type experience could be there for him. And he said he felt nothing. And basically he has, you know, we could say he has protector parts that just shut it down. He did not feel safe letting go on that higher dose, and he felt less than he felt on 100. Another client I worked with, the first session she took ketamine, she was sitting, she could have lied down on the couch, but she was sitting and she kept kind of going back and forth, like her body kind of wanted to lie down. She'd say, I want to lie down, but then she couldn't quite bring herself to do it. And so, you know, she just didn't quite feel safe letting go, and that's fine. That's where she was. We worked with that. The next session, she was able to lie down and really let go and have some big breakthroughs. In terms of relational and transference issues, you know, when the guy had the 300 milligrams, did you give me the wrong dose? You know, are you doing something wrong, right? People can have very strong reactions when they feel like they're not getting what they hoped for in these sessions. And especially with the Michael Pollan effect, you know, people have these huge hopes and fantasies about what they're going to get, and it doesn't always work that way. And so that can be something that you really need to work with. On the other hand, you know, I have a client who I worked with for a couple of years before they did the ketamine, and they said, I could only feel safe because I really know and trust you. Like 3 preparation sessions was not going to be enough for this person. And then finally, in terms of the complexities, I alluded to this before, just having 3 or 4 hour sessions, that in itself is kind of psychedelic. That can pull for things in people's psyches, that can manifest things, and especially someone with complex trauma, that can really be quite triggering and can trigger abandonment fears and things like that. And so, this can be really hard work, like you would experience with a very difficult, complex trauma person. And now you've got, longer sessions and potentially a medicine introduced. So yes, this can be very difficult work that requires supervision and peer supervision. And, I definitely want to emphasize that it's not all like, hey, this is great, everybody's having wonderful experiences. I've had some very difficult experiences too. But I think I've given a pretty decent feel. Do you guys want to stop now, or you want to give me a couple more minutes, or what do you want to do?
Oh, take some more time. We're loving it.
Okay, so I want to say a little bit about contemplative aspects of this. And, as Chris mentioned, I'm a long-term meditator and definitely think about and reflect on these things. One way of thinking about these sessions is, in terms of degrees of access and intensity and embodiment that we can get to these dimensions of our mind and soul, you could say. And so, in typical therapy sessions, we have our sessions that are really profound and where people have big breakthroughs, and then we have ones that are less, and they can't all be big and profound, right? But one way to think about this psychedelic work, whether it's MDMA or psilocybin or ketamine, is that it increases the probabilities you're going to access some really powerful stuff, and really I would say, basically the infinite love and wisdom that we all have within us, that we can get access to some degrees. Sometimes you can get way more access to it if you have the right conditions, and these medicines for you are opening those doors for you. And so, I just use this imagery to just convey, like, we're talking here about degrees of access and intensity, and not just psychological, but in your body. And these can be very powerful embodied experiences. And one way to think about this is the medicine, whether you're, quieting down the default mode network or this or that, you are opening the parameters of brain processing. You are getting some obstacles out of the way so that people can receive some very powerful stuff. And so one way to think about what they receive from a contemplative perspective is, especially in trauma work, right? People can receive, difficult memories, painful memories, great suffering, things that they're deeply ashamed of or feel guilty about. But in these states of consciousness, with the right support, they can experience the full force of that, but in a larger context where it can actually be healing. And another aspect of it is they can access what I would call, the good, and, the visions of their future. So love, joy, playfulness, beauty. People can access these in very, very powerful ways that can give them a hope for the future. That can give them a hope in themselves, a hope in humanity that they had no idea was possible for them. And, to hang out in a state of consciousness like that for, 30 minutes or 2 or 3 hours and really feel it in your body, that is very powerful. And with the right support for integration, that can be transformative. So one way to think about the contemplative aspect is contemplating the past and the painful things in your life and healing them, but also accessing just, really powerful beauty and good and love and wisdom, and having a confident sense that, wow, that could be part of my future. And this is within me and within all people. And so one common progression I've seen in the MDMA work is in the first session, especially because we're using like 80 milligrams for the first session, the fear tends to recede. People get these experiences of equanimity, we would say, from like a Buddhist tradition, Christian tradition. We talk about equanimity too. People get access to more mindfulness and compassion than they would normally have access to. It has this noetic or revelatory quality to it, of like, a Gnostic kind of thing, like you're just tapping into things that are true, and no matter what anybody says, like, wow, this is profound, and wisdom and insight. And then over the coming sessions, the second and third, that's how many we do in the MDMA study, what often we'll see is people have a really deep emotional engagement with their trauma. So like in the first session, there might be a lot of life review with equanimity and mindfulness. And then in the second and third, they may really dive into the really hardest traumatic memories with deep emotional engagement. And so they may relive, intense fear and sadness and shame, but in the larger context of loving acceptance. They may have experiences of liberation from old suffering, old ways of viewing themselves. And some of these liberations are permanent. Not all of them, though. They may have experiences of embracing their highest values and just kind of feeling like steeped in love or in generosity or in compassion for people who are more vulnerable than them, whatever it might be. But people can access their highest values and really just feel them in their body in a very intense way for a significant period of time. And that can be quite transformative. And as I said before, sometimes in these later sessions, especially sometimes as they get to the third session and they know it's their last session, there can be more focus on their future and just having these wonderful visions and realistic ones about what their future could look like and who can support them with that and how they can get there. With ketamine, because you can use the different doses, there can be many paths. And I just feel like I can't really do any of these things justice, of course, but I'm just, giving you hints of things. Often in that first session, we do it again with a 100 milligram lozenge to see how sensitive people are. And people tend, not always, but they tend to have a feeling of lightness. Their mind quiets down. They have experiences of mindfulness, of compassion that spontaneously arise. Again, this noetic or revelatory and wisdom and insight can emerge for people very powerfully, quote, just on 100 milligrams of ketamine. And then in the subsequent sessions, right, you can go to lower doses that they can potentially use at home if there's not an addiction liability issue, if they really feel safe doing it. People can do amazing work with ketamine at home. And then I get on with a Zoom call after they've come out of the experience, and we do a 60-minute integration session. And so they might do 50 or 75 milligrams, or even 100 if that's what's appropriate for them, and then do integration. Or they can go all the way up, not at home, of course, with an MD present. They can get one of these injections that can give them, an experience of Dharmakaya, or some, just bliss experience or unity with God, perhaps. So there's an incredible range of experiences people can get. So they can soften their defenses and relax their protectors. They can really work with emotions and embodiment at these lower doses. They can process memories and relationship issues. They can have epiphanies and mystical experiences, even sometimes at the lower doses, but more likely at the higher doses. And again, people can really access and embrace their deepest values and visions for their future. So here's some first words from a client I just worked with. This is a person who happens to be a long-term meditator, but also suffered, very significant emotional neglect in childhood, extremely severe. We did like maybe 5 prep sessions, and one of those was he showed up for the medicine session and he forgot his medicine. Well, he wasn't ready yet, so we needed, more preparation, and that was fine, and so we worked with that. But then when he finally did it, his blood pressure was up. We checked his blood pressure multiple times. He was anxious about it, checked in with the MD, prescribing, helped him get blood pressure down. He took it. And then he had this incredible experience. And he said, I knew this could happen. I knew this could happen. So this is what he says when he finally emerges, takes off the headphones, comes out. I knew there was more in me. I knew. And then he just says a string of yes, 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 yes. That's all I need to say. So he just kind of basks in that for a little bit. And then he said, that's all I wanted to learn, Jim. We're in Geppetto's toy shop and you're Geppetto. So this is an allusion to Pinocchio, who comes alive in the toy shop because the toy shop owner, Geppetto, and he had this experience like he'd always known he could feel, but he had been so alexithymic. This is a man who had cried like twice in his life and just learned how to perform emotions, but not really feel them. And this session with the right preparation, 100 milligrams of ketamine, he had this breakthrough where for the first time, he felt like he really, in a big way, accessed his emotional capacity and just experienced this incredibly beautiful opening to the world of mood and feeling. And it was just incredibly powerful for him. And he said, at the beginning, I felt like it was important to have my hand held to go through the veil over the threshold. So I was holding his hand, and then he let go of my hand and he put his hands on his heart. And he said, then my mind went completely still. It was a profound thing. It was beautiful. I went into this beauty. It was more the mood than the imagery. The mood was beautiful. And then there was a track pretty far along in the playlist, about an hour in. And he said, then when she was singing, "You're Not the Story You've Been Told," I was majestic. I never have experienced anything like this before. Not in a bold or egotistical way. I still feel that kind of low presence of radiance, like my heart is glowing now, like a glowing ember radiating love. What a feeling. And so, this is just an example of the kind of things that I'm hearing from my clients. And again, it's not all this easy stuff. There's people who are having old attachment stuff get triggered, and we're having to work through that in the relationship. But ketamine can be quite profound in its healing. So integration, one way of thinking about integration is literally just asking people, what did you experience? What insights did you have? What resolutions did you make? Sometimes people, you don't necessarily ask someone, but sometimes you can see what's going on. People make these resolutions. I'm going to relate to my child this way. I'm going to do this differently. And so you ask them about these things. And, one of the things that's implied that we're asking is, well, what goods or values or virtues did you access and do you want to embody going forward? What new habits do you want to cultivate? Right? Because it's one thing to have a big experience. It's another thing to integrate it into your embodied experience and into the habits of how you relate to your emotions, how you relate to your body and other people. And that's what the integration work is so much about, is openly asking these questions and then working with people in their own unique ways to support them. So you're in integration, you're flexibly utilizing a variety of models and interventions that as a unique therapist, and you're supporting the client as a unique human being with their own creativity. Maybe they've got a meditation practice, maybe they got a yoga practice, maybe they like to hike, maybe they like to dance, listen to music, play piano. There can be so many different things that we can draw on and support them to draw on to integrate, what it is that they gained access to in that expanded state of consciousness on the medicine with our support. And that's just so important. The integration is absolutely vital. And it may be months between a session and another medicine session, just to really work on the integration process. So those are, some of the key things I wanted to talk about to try to give you a feel for what this can be like. I'll give you some quotes from people, the ways I think about this and frame these things that I've found helpful. And I hope they were helpful to you too. Thanks for your attention.